So our illness topic is cardiogenic shock. So to begin, what exactly is cardiogenic shock? Well, let's first start with the word cardiogenic. Let's break it down. Cardio means heart, and the suffix of genic means cause. And shock broadly means a potentially life-threatening condition that occurs when the body is not getting enough blood flow. So there are 5 types of shock. There's anaphylactic, which is caused by an allergic reaction. There's hypovolemic, which occurs when the body loses 20% or more of its blood supply. There's neurogenic, which occurs after damage to the central nervous system. There's septic shock, which is the result of bacterial, viral, or fungal infection, known as sepsis. And then there's ARS, cardiogenic shock. Directly, cardiogenic shock is a condition in which one's cardiac output is so low that the heart cannot send enough blood around the body to perfuse tissues and organs. Cardiac output is the amount of blood pumped by the heart per minute, and stroke volume is the amount of blood pumped by the left ventricle each beat. So cardiogenic shock has nothing to do with this. It has nothing to do with lowered blood volume. It is low cardiac output despite adequate intravascular volume. So where is the main issue occurring? Is it a problem with preload, afterload? Well, it begins with the pump of the heart, or the contractility. The main pumping chamber of the heart is the left ventricle, and the left ventricle is the last area the blood passes after being oxygenated via the lungs. So with cardiogenic shock, there's commonly a structural problem with the pump. However, preload and afterload are still negatively affected. Think of it as a vicious cycle sort of sense. So preload is the filling pressure of the heart and it becomes excessive, especially since the returning blood to the heart is added to the blood that previously was not pumped along. Thus there is a buildup or backlog of blood, which could potentially leak back into the lungs, causing blood in the lungs which can be heard as crackles upon auscultation. As well, the afterload, which is the resistance the heart must overcome to eject blood, is increased, thus decreasing cardiac output as well. So what are some of the signs and symptoms of cardiogenic shock? I've just mentioned crackles in the lungs heard, but there's also an increase in heart rate resulting in tachycardia. There's a lowered blood pressure or hypotension and lowered oxygenation percentage. As you can see with this sad face, diaphoresis or excessive sweating is another sign of cardiogenic shock. Increased respiratory rate and severe shortness of breath as one is gasping for more oxygen to perfuse the tissues. There's decreased level of consciousness, confusion, or agitation. And part of the collaborative care, nurses and cardiologists will hook the client up to an ECG or electrocardiogram to read the heart's electrical activity, the rhythm, the activity. I'll be honest though, I personally have no idea how to read these tests yet, though supposedly next year we'll be taught, so I'm looking forward to that. So what exactly causes cardiogenic shock? I mentioned earlier it can be structural damage to the left ventricle. Well, to be honest, the most common cause is a myocardial infarction, or in other words, a heart attack. So here's the heart attack occurring. It's getting smushed, it's failing. Though, we need to keep this heart healthy, or at the very least, functioning. So what can nurses do to treat CS? One must always remember, time is tissue. Whatever treatment is done must be done fast, as 20 minutes can be the difference between healthy and necrotic tissue. So the main treatments are to focus on increasing the cardiac output, reducing the workload, and increasing coronary perfusion. So a vasodilator can be used to increase myocardial oxygen delivery, decrease venous return to the heart, and reduce arterial resistance. So this medication works on the preload, afterload, and the pump. To increase coronary perfusion, one can reestablish perfusion through heart catheterization by administering a stent so blood flow can continue and increase the cardiac output. And here what it would look like. So there's our presentation on cardiogenic shock. Hopefully you enjoyed that, and yes, thank you very much.